So the question was, what is canine influenza and how does it affect dogs? It used to be, if you asked me 10 years ago, can dogs catch the flu? I would have said no, there's no such thing in the dog. It turns out that today there is such a thing as canine influenza. And when I say influenza, I'm talking about an actual influenza virus which causes fever and upper respiratory tract infections. The equine horse influenza virus mutated and infected dogs at Greyhound racetracks in Florida several years ago, and that was the beginning of canine influenza. Since that time, the virus has swept up and down the East Coast and has come across the country to California as well. It is spread just like every other upper respiratory tract infection in dogs. So it's part of what we call kennel cough, which essentially means one dog coughs, the other dog breathes it in, they incubate it for several days, and then they start coughing. It is rare, but it is contagious. Now we have a vaccine to protect dogs against it. Here at our practice, we only recommend vaccines that we think our pets need. Because we live in an area that has a lot of dogs and they are often very social, we're asking our clients, does your pet, does your dog go on walks? Does it go to the park? Is it going to the kennel? Is it going to daycare? Is it getting its hair done? And those dogs that get together socially are at risk for agents that can be spread through coughing and inhaling. Because Bordetella, the bacteria, is very common, we routinely vaccinate all of our patients against, all of our social patients against Bordetella. Because influenza is rare, we ask the client, do you want to vaccinate against influenza? It's spread the same way, so it's the same risk group, but because its occurrence is less common, it's not often vaccinated against in the community. But the vaccine's available, it's safe, and so we offer it for our clients. If a dog got canine influenza, it would look a whole lot like kennel cough. Fever, feeling crummy, coughing, and risk of secondary lower airway infection from bacteria, which is the more serious, you know. And so the group that I'm most interested in vaccinating are dogs who have compromised airways, like the short-faced dogs, right? So the bulldogs, the Bostons, because when those dogs get upper respiratory tract infections, they are at greater risk for getting the lower airway pneumonia because they can't expect to very well. Yeah, good question.